Welcome to those of you who are in the room and at your desks or sitting in your pajamas, wherever you might be. Um, First of all, to tell you just a little bit about California Wellness. The California Wellness Foundation is one of the largest healthcare foundations in the state, of which there are many others who join us in this work. We've been around for almost 25 years, and 9 of those years we've been the proud sponsor of the CalWellness Field Poll. It's been an important part of our efforts in informing the state, informing public policymakers, and raising awareness about an issue that we care deeply about around health equity. You are in for a treat. If you like data, you're going to find out more data than you've ever wanted to know today, thanks to our friends at the Phil Poll. And if you like to be stimulated by some of the most interesting and informed folks about health care in this state, we have an amazing panel. And if you're like me and you want to enter into the conversation, we're going to provide an opportunity for you to join into that conversation. So I think it's really going to be a treat. One of the things that I want to just touch on, because it's so important, I've been in this job for about 16 months. I think it's one of the best jobs in California. And we give out about $35 million a year, and all we do at CalWellness is we get up every morning and we think about how we can provide support and resources to communities across this state, underserved communities, around issues around health equity. But I used to think $35 million was a lot of money. It is a lot of money, but if you're really talking about health equity issues, it's really not. So we need partners. And I just want to acknowledge some of those partners. One would be our other colleagues in the philanthropic field. California is really rich, and we think one of the reasons why the news is so good in this year's poll is that we really have a strong partnership with other funders. So we do this work with our colleagues from the Sierra Health Foundation, California Endowment, California Healthcare Foundation, Blue Shield, Kaiser, and many other individual donors in the philanthropic. We also have a real commitment to public policy and a recognition that government plays a huge role. We are really lucky to be living in California. It's, as the poll suggests, it is a state that really recognizes the importance of health equity. And I know that many of you that are here have chosen to provide your talents and your skills to crafting policies, to serving this great state and residents. And so I want to just provide a shout out to you. I grew up in Alexandria, Virginia, outside of Washington, D.C. Both of my parents worked in government. I have benefited from really good government policy, and I'm even more impressed with the role that government, and certainly California, and the voters have noticed that in terms of health care, California is working and the government is working every day to provide support. There's still a lot of work to do, but we just want to acknowledge the work of many of you who are really focusing on public policy. The other thing I would just say is that the news from the Phil poll, you'll hear a little bit more about it when Mark talks about it, but I think it can't go unnoticed that as the most populated state in the country, that I'd like to think that we're leading the way of how to provide health care to a very diverse state and do it in a fiscally responsible way. I think if your policymakers, hopefully those outside the state will take notice that you can provide health care to all human beings without worrying about their immigration status. There are still some concerns, obviously, about affordability. We'll talk about that. But the other real story is the role of our partners in the advocacy community. These are folks that continue to also work every day in raising awareness about the issue. So we think the story is good. There's a lot of work to be done, and so we're kind of eager to get into the conversation. Let me just review what we see as today's kind of agenda. We're going to start with Mark providing a great overview of his work, and that will give you the data, more data than you'll ever want, but it's interesting in terms of the numbers. We will then also have the panel come up after that, and you have their bios. We are really just honored that Diana Dooley, Secretary of the California Health and Human Services Agency, will be joining us. Peter Lee, Executive Director of Covered California, two examples of two great public servants that are working every day for health care in this state. Sarah Guia, who is Executive Director of the California Pan-Ethnic Health Network, one of the strongest ethnic and advocate organizations that's really working to be sure that health care is promoted throughout the community. And then Juan Esparza Loera, who's the editor of Vida on El Valle, a community-based publication in the Central Valley, a reminder of how important the press and communication is in advocacy and public education. So it's a great panel discussion, and we'll make sure, start thinking about questions that you might have. We'll be collecting cards. So I'm going to turn the podium over to Mark DiCamillo. Mark, you're a great partner. I think you and the Phil Corporation has really provided us a great picture and profile of not only health care, but the work that you do every day in educating Californians. So could you guys join me in recognizing Mark?
Thanks very much, Judy. Very eloquent introduction and remarks. We too at the Field Poll are very proud of our long association with the California Wellness Foundation. As Judy said, this is the 9th year in which we've done this annual survey of California registered voters about important health policy issues facing the state. I've been director of the poll for those 9 years, and as such, my main job is to try to do everything possible to make sure that these measures are reflective of the overall statewide registered voter population, and that the poll tracks 1 year to the next. And we do that by asking the questions when we have tracking measures in exactly the same way and projecting it to the same total population. I think these polls are an important public record because it really documents how California voter opinion toward the Affordable Care Act has evolved over time. I mean, we started the poll before the Affordable Care Act was even enacted. It was during the Schwarzenegger years in which the state was taking on health reform. But so we have this continuous measurement of voter opinions both several years prior to the passage of the Affordable Care Act and right through today, since its passage in 2010, we're now 5 years afterwards. And it really provides, I think, an illuminating view of how voter opinions have changed and evolved over time, and I'm going to share those results with you. Okay, this year's survey was conducted among 1,555 registered voters. Now, this poll is a good representation of voters in all parts of the state, all age groups, all race and ethnicities, and by party registration. The survey was done by telephone. These days, a cell phone is the dominant form of interviewing when you're doing a telephone survey. I think between 2/3 and 3/4 of all voters interviewed in this survey were actually interviewed on their cell phone, the remainder on their home landline. Because of the importance of the survey to the state's ethnic voter population, we translated this survey into 8 different languages. It was administered in English, Spanish, Cantonese and Mandarin, Tagalog, Korean, Vietnamese, and this year for the first time, Hindi. And we included oversamples of the Asian American voter population. Since it's such a polyglot, we interviewed specific samples of Chinese, Korean, Vietnamese, Filipino, and Asian Indians to be included so that we had large enough samples that when we combined the results, we had a really nice representation of the Asian American voters. Now, the sample is certainly large enough to represent the Latino voting population. It's very large all by itself, and the African American population, as well as the white non-Hispanics. The overall results have a plus or minus error range of 2.6%. The interviewing for the survey was done in late June through mid-July this year. Now, the poll covered many topics, and actually, I'm going to present 7 of the major topics that we covered in the poll. Judy had to rein me in a little in terms of the data because I am a little bit overwhelming when I get a data set in my hand, and we're going to basically focus in on these 7 major areas, which I think are the major parts of the survey. First, we'll be updating California registered voter opinions toward the Affordable Care Act, the importance of Medi-Cal to voters and their families, and how successful the program is perceived in meeting its program goals. Should Medi-Cal actually be expanded to cover the undocumented? Has the state been successful in implementing the Affordable Care Act and in establishing covered California? How satisfied are voters with the overall functioning of the state's healthcare system? Have opinions about this changed over time since the Affordable Care Act was passed? What about the challenges facing voters with regard to affordability? We'll be talking a little about that, and then we'll conclude with some other new policies that are currently under discussion in the state and how voters are reacting to each of those. Okay, the first section, updating California voter views on the Affordable Care Act. The first slide shows you the results from this year's poll. Statewide, 62% of registered voters, now support the Affordable Care Act. That compares to 33% who are opposed. This is quite different than the national public. The Kaiser Family Foundation, in its regular polls of the U.S. adult population, its latest numbers show 44% having a favorable view, 41% unfavorable view of the Affordable Care Act. So California is clearly out ahead of the rest of the country on this. One other thing I'd point out in this slide is that opinions are very strongly held. That is, if you support the law, you're very likely to be supporting it strongly. If you oppose the law, you're likely to be opposing it strongly. We do have the benefit of looking at public opinion over time, and since its passage in 2010, the first 4 years following its passage, public opinion in this state was supportive, but it was fairly stable, and kind of ranged between 52% and 54% support. However, since its full-scale implementation in 2014, public opinion has actually started to move upward. Last year, it increased to 56% support, and the current poll shows it increasing further to 62%. The poll has lots of demographic subgroups. Because it's a large enough sample, we can look at all the various facets of the state's registered voter population on this issue, and I'm going to show you some of them. On the right is the support levels. On the left, those who oppose. And on the far right is the change in support compared to last year's poll, so you can get a sense of the direction of change over time. When you look at the results by region, clearly Los Angeles County and San Francisco Bay Area are the two areas of the state where support is strongest. That's always been the case. However, for this year, for the first time, we have a majority supporting the Affordable Care Act in all regions, all major regions of the state. It includes the Central Valley, the South Coast, other parts of Southern California that in prior years did not touch a majority. When you look at the results by party, you still see a very strong partisan effect. This is true nationally. It's still true here in California. Democrats in this state are overwhelming in their support of this law. It's almost 8-1. Republicans are opposed almost 3-1. No party preference voters, which somewhat make this state unique. These are independent voters, tend to follow the Democrats much more than the Republicans and are supportive almost 2-1. When you look at the results by race and ethnicity and by age, one thing that's striking is that now we have majorities in support of the law across all major segments. This, again, is the first time we've seen that. White non-Hispanics are now at 57% support. That's up 7 points from last year. Latinos, African Americans, Asian Americans have all been more supportive than white non-Hispanics in prior polls. They continue to be, and you see some increases among the Latinos in this year's poll. The age distribution, the differences here are relatively modest, and I would say they mainly relate to the composition of each age group. The younger you get in the voter registration files, the more ethnic voters there are, so you get somewhat greater support among the younger voters, but all segments are supporting the law. You can also look at the results by insurance status, those who are uninsured and those who are insured, and if they are insured, where do they get their insurance coverage? One of the things that's striking is that there is support across all segments, and support is greatest among those who are Medi-Cal recipients. And you can see that support has pretty much increased across the board among all segments in this year compared to last. Okay, the next section of the presentation is about the importance of Medi-Cal. Is the program successfully meeting its goals? The first thing that I want to point out, and I made a big point of this last year, is that Medi-Cal is becoming a very broad-based program. And it's not a niche program. This is a program that touches a large majority of California voters. In this poll, 63% say that Medi-Cal is a program that's important to themselves and their families. And most of those 63% say it's very important, 45%. That compares to just 34% who say it's not important. And when you look at the trend over time, what's striking is that the proportion of voters who say it's very important keeps increasing year after year. In 2011, 28% said Medi-Cal was very important to themselves and their families. In this current poll, it's up to 45%. When you look at the results of this question across ethnic populations and by income, and also among Medi-Cal recipients, you see that the proportion who say it's very important, clearly almost all Medi-Cal recipients say it's very important to themselves and their family. You can see much greater likelihood of saying that among the lowest income segments who comprise most of the Medi-Cal recipients. It's also got a larger proportion of ethnic voters in saying that it's important to themselves and their family, 66% of Latinos, 55% of African Americans, 61% of Asian Americans. And when you look across these subgroups, most of them are showing significant increases compared to last year in terms of the proportion saying it's very important. One of the other measures we get on Medi-Cal, just as a broad measure, is how successful do voters think the state's Medi-Cal program is in meeting its main program goals and objectives. And in this poll, we find 68% of voters saying it is successful, just 17% not successful. And who's saying that? Well, I find it interesting that the same populations who say that this program is very important to themselves, or are more likely to say it's very important to themselves and their families, are also the populations saying that the program is successful. I think that's a significant finding. Medi-Cal recipients, 85% say it's successful. You see there are some partisan differences on this question, but even a majority of Republicans, and again, remember, Republicans are opposed to the Affordable Care Act. They basically think that Medi-Cal has been successful in meeting its main objectives. You can see that the ethnic populations are more likely to say that than the whites, but even among white non-Hispanics, 60% feel it's been successful. Okay, this is the topic that grabbed the headlines today if you're looking at the state's news media. Should Medi-Cal be expanded to cover the undocumented? We had several questions about that. I assume that in future years we'll be covering it in even greater detail. What we did in this year's survey was we repeated a question that we first asked last year to see if anything had changed over time. And here are the results. Basically, should Medi-Cal be expanded to provide preventive health services to the state's undocumented residents? It was worded exactly the same as in prior years. 58% now say they favor that idea. 39% are opposed. Similar to opinions about the Affordable Care Act overall, opinions about this are strongly held. Most of the people who favor it say they favor it strongly. Most of those who oppose say they oppose it strongly. When you look at the demographic subgroups on this question, a lot of this mirrors views on the Affordable Care Act overall. There's huge partisan differences about views about expanding Medi-Cal to the undocumented. Democrats are quite supportive. In fact, 10 points higher this year than last. 79% of Democrats favor the idea. Republicans are opposed, 72 to 25. But as with the overall law, no party preference voters are much closer to the views of Democrats. There are majorities, even among white non-Hispanics now, saying that they favor the idea of expanding Medi-Cal to the undocumented. That's a 10-point increase from last year when 41% of whites felt that way. We've always seen Latinos as a segment, Latino voters being most likely to support the expansion of Medi-Cal to the undocumented. We see it again in this year's poll. Other ethnic populations are also quite supportive. Has the state been successful in implementing the law? How do voters feel about this, and what do they see in terms of covered California? The first general question about how successful do you think the state of California has been in implementing the Affordable Care Act? 68% of voters see the state as being successful in this regard. Just 20% say it's not been successful. That's greater than 3 to 1. And when you look at the numbers on the right side, compared to prior years, we see an 8-point increase from last year who say that the state's implementation of the law has been successful. So higher marks this year than last. When you look across voter segments, you do see some partisan differences, but in contrast to general opinions about the Affordable Care Act overall, you even get a plurality of Republicans saying that the state's implementation of the law has been successful. I think that's interesting. 49% of Republicans feel that way compared to just 33% who say it's not been successful, and it's been actually a 10-point increase among Republicans over the past year on that score. So it's narrowing the divisions, the partisan divisions that were first observed in terms of the Affordable Care Act, at least in the implementation side. You can see that there's high levels of views that the state has been successful across the state's ethnic populations, with about 2/3 or more within each group saying that, and there have been significant increases across most of those populations from last year. We also included questions that asked about the specific goals of the Affordable Care Act and has the state been successful in meeting those specific goals. Here are 4 of them, and as you can see, the state is scoring well on each of them. Encouraging more previously uninsured residents to get coverage. That one scores highest. 75% of registered voters think the state had been successful in that. Just 18% say no. That's up 9 points from last year. Expanding Medi-Cal to extend health insurance to more low-income Californians. 68% of voters say the state has been successful on that. Just 18% say not, up 5 points from last year. Providing California consumers with more insurance choices. That's about a 2-to-1 margin. Obtaining the federal funds needed to implement the law. Also, 59% believing its success of the state's been successful there. 21% saying no. That's up 8 points. There were 3 other items included in this measurement. 2 of them also score quite high. The state scores high. Establishing Covered California is seen by a greater than 2-to-1 margin as being successful. So a good endorsement there of Covered California, and that's up 9% from last year. Providing health insurance buyers with better consumer protections, also about a 2-to-1 ratio in terms of the state getting positive marks on that item, and that's up from 7 points. The only area where voters offer mixed opinions and not a clear endorsement of the success of the state in implementing the law has to do with affordability. Limiting the rate increases that insurance companies charge to their customers each year. We get mixed views about this. 42% say the state's been successful, 44% say it hasn't. But even that 42% who say it's been successful is up from last year when it was 37%. One of the interesting trend measures that we're seeing is how many registered voters say they have personally visited Covered California website. I mean, we're talking about, and these are registered voters under the age of 65 because that's the target market for this program. And nearly half of all voters under the age of 65 say they have personally visited Covered California. That's a fairly astounding number. And of those, 8% in total of the registered voters under the age of 65 say they actually got their coverage there. When you break this down by subgroups of the state's population, and also looking at it over time, how much has it changed? That 48% that we're seeing this year in terms of having visited Covered California is up from 36% who said this last year. Of course, we've got a 2-year period in which you could have visited Covered California. Makes sense that it has gone up some, but it's a significant increase. And when you look at who is actually visiting the site, most of those, and this makes quite a bit of sense, those who are uninsured, even though they didn't get coverage, none of the currently uninsured got coverage, have visited the site. And again, these are registered voters. And then those who had some lapse in their coverage over the past 2 years. So they have intermittent coverage, not continuous insurance coverage, and you would expect they're a little more insecure about their insurance, and they clearly were more likely to have visited the site, and actually are the subgroup of the population most likely to have actually purchased their insurance from Covered California. Not a lot of differences across the major age brackets through age 65, with about half or so of the population saying that they have visited the site. We do see some increases, though, at both the high and low ends, more younger voters saying that they visited the site than said this last year, and more of those age 50 to 64 saying this. When you look at it by ethnic population, first I want to remind you that we're looking at registered voters under the age of 65. So it's not the broad ethnic adult population. We're talking about voters. These are all citizens because they're voters, and they're all took the time to be registered and are included on the voter rolls from which we sampled the voting population. But you can see that the African Americans and Asian Americans are actually the subgroups that have the higher take-up rate of covered California, at least from the voting population, than you're seeing among whites or Latinos. It's an interesting finding. And also, even though non-English speakers were much less likely to have visited the site, only a third, their take-up rate, according to the poll, is higher than it is among English speakers. And I think that has a lot to do with the probably greater vulnerability of this population, and they're searching for alternatives to get insurance. Okay, the next set of findings, this has to do with the overall, the way in which voters view the overall healthcare system and how it's working in California, and how has this opinion changed over time during the period in which the Affordable Care Act was enacted. And again, this is the broadest measure in the survey, where we actually start out the interview by asking voters this question: how satisfied are you with the way the healthcare system is working in California overall? And in this year's survey, we find 58% of voters saying they're satisfied, 34% dissatisfied. That's positive finding. But what's most interesting is when you look at results over time on this measure, again, the broadest measure of how the healthcare system is working in California. Prior to the passage of the Affordable Care Act in 2008, voter opinions about the way the healthcare system was working were almost evenly divided. 50% were satisfied, 46% of voters were not. You can see, though, that there has been an increase in satisfaction over time, and especially since the full enactment of the Affordable Care Act in California in 2014. We're now at a point where you have a 24-point plurality of voters saying they're satisfied compared to those who are dissatisfied. That really is a positive set of numbers. I think it's one of the more significant findings in the entire survey. When you look at the results across segments of the voter population, you do see partisan differences in terms of the ratings of the functioning of the healthcare system, but not as great as there are towards the law itself. Democrats, more than 3-to-1, saying that they're satisfied with the way the system is working. Republicans, about evenly divided, 49% dissatisfied, 42% satisfied. Nonpartisans, again, more likely to be closer to the Democratic side. Majorities across all ethnic and racial populations are saying they're satisfied now. As we've seen in prior years, the ethnic population's more likely to say this than the white non-Hispanic population, but even a majority of white non-Hispanics are satisfied with the way the system is working. That's not to say there aren't any remaining challenges facing California with regard to health care. And the survey documented a number of the things relating to affordability as an issue. This year, as we did in prior years, we've asked people to tell us whether the amount they pay for health care increased, remained about the same, or decreased compared to what it was last year, to what they paid last year. And what you see is that a fairly large proportion, nearly 4 out of 10 registered voters, say that their health care costs increased last year. That compares to 48% who said that remained about the same, 8% saying it decreased. When you look at this over time, though, that 39% who said increased is actually down from previous years. In 2013, 50% said their health care costs had increased compared to the prior year. In last year's survey, 47% said their health care costs had increased compared to the prior year. So even though the problem is still prominent to 4 out of 10 California voters that health care costs are increasing in a significant way, it's a little better in terms of how things are going. At least it's moving in the right direction compared to prior years. Now, when you look at the population of voters and who is saying that things have increased, no surprise that uninsured voters are more likely than insured voters to say that their own costs are kind of uncontrolled. But the interesting segment here, I think, is who, when you're getting your insurance coverage, who is saying that their costs have increased? Actually, the biggest change compared to last year is the cost increases among those who say they are insured through their employer or through a labor union. 46% of voters say their costs went up last year. That's a 10-point increase from the prior year, the biggest jump of any segment. In fact, each of the other segments actually went down in terms of the proportion reporting increases. If you purchase through independently or through Covered California, you're more likely to say this than other population groups, but the proportion saying that actually went down 6 points last year. If you're insured through Medicare, and especially if you're insured through Medi-Cal, much less likely to say that there have been increases in the past year. And the Medi-Cal population in particular had the biggest drop in terms of the proportion reporting increases. And I think this has to do with the broadening of this population compared to last year. There are many more voters now who are included in Medi-Cal than was true last year. We ask a second question on affordability, and this just has to do with how difficult is it for you and your family to pay for health care? And we get kind of similar results, 42%, about 4 out of 10 saying it's difficult for them to pay for health care. 55% say it's either not too or not at all difficult. And the same kind of trend appears over time. When you look at this question compared to prior years, the proportion who say it's difficult has actually declined. In 2013, 50% reported this, last year 46, and this year 42. So it's moving in the downward direction in terms of the proportion saying it's difficult for families to afford. And here is a kind of an examination of the subgroups on this question. The uninsured are much more likely than the insured to say it's difficult for them to pay for health care. And when you look at the results across income segments, I find this interesting. The proportion who say it's difficult to afford is actually a quite broad-based population. We're not just talking about lower or even middle-income voters. We're talking about voters going over 4 in 10 of voters all the way up to making $100,000 a year are saying it's difficult to afford. So this is a problem facing a broad swath of voters. Even 28% of those making over $100,000 say it's difficult. I would guess that those are probably closer to the 100 to 150,000 range than those who are making millions, but still, it's a broad-based problem, and you need to consider it in that light. Finally, we did measure some other policy matters facing the state in this year's poll. The first one relates to the public's overwhelming support, 78%, for the idea of increasing government oversight of insurance companies to ensure that their listings of doctors and other health providers are up to date. This has been a problem for many voters, whether you're insured through your employer or whomever, to make sure that you know which doctors are in your network. Voters would like greater oversight by the state in that realm. The next one has to do with a policy matter that may actually be on the ballot next year, and I think is being their deliberations in the Capitol this week on this matter. It has to do with increasing the state's tobacco tax by $2 per pack. The monies would be used for prevention, smoking prevention, for research, and for enforcement of the laws. There's 67% of voters are initially supportive of this proposal. And in fact, most of those, 50%, say they favor it strongly. That compares to 30% who are opposed. Another issue that we measured had to do with the state's minimum wage, increasing the state's minimum wage by $1 per hour per year for each of the next 5 years. Voters are quite supportive of that, and I see these findings as being consistent with views that voters believe that there's been a widening of the wealth gap in California. We've seen that in other field polls, that the difference between those who are well off and those who aren't is increasing over time. And I see this increasing the minimum wage and sentiments for increasing the minimum wage, both at the local level and at the state level, is an attempt of voters to try to remedy the situation somewhat. And the last measure is just a kind of a summary view. Do voters think that this Affordable Care Act's main provisions are here to stay, or will they eventually be eliminated? And most voters in this state, anyways, are optimistic. 57% think the Affordable Care Act is here to stay. 31% believe it will be eventually eliminated. So, in sum, before I leave the podium, I just want to wrap it up by saying, what do I take away from the survey? Well, number one, California voters are increasingly embracing the Affordable Care Act, and large majorities believe that California has been successful in implementing the law. Number two, implementation of the law has had a positive impact on how voter opinions of the way in which the healthcare system is functioning overall in the state. Number three, Medi-Cal is becoming increasingly important to voters and their families, with nearly half now saying it's very important to them. Number four, more voters are now inclined to support the expansion of Medi-Cal to the state's undocumented residents than said this a year ago. It's now a 58% majority. Number five, large proportions of voters remain concerned about the affordability of health care, and the view that health care costs are difficult for people to afford is a broad-based view, with greater than 4 in 10 of voters in all income segments going up to $100,000 saying health costs are difficult for them to afford. Thank you very much.